And Corla, Minister, we were told last May that there are 149 doctors working in the HSE who are working in consultant posts, but unbeknown to patients, are not in fact on the specialist consultant register. And we were told that some of this is because of legacy administrative issues, but some of them are because the consultants haven't actually, or the doctors haven't finished their consultant training. This to me represents a very serious potential patient safety issue. My question is, will you issue an instruction to the HSE that any patient seeing a consultant who is not in fact on the specialist register is told that that consultant is not in fact on the specialist register and why they are not on that register? Thank you.
Thank Deputy Donnelly for raising this important matter. In March 2008, the HSE amended the qualifications specified for consultant posts to require membership of the Specialist Division of the Register of Medical Practitioner, and this register, as the Deputy knows, is now maintained by the Medical Council. However, notwithstanding this policy position, in certain circumstances the HSE has been obliged to appoint doctors who are not on the Specialist Division to consultant posts in order to ensure service delivery. There are also limited circumstances where an experienced senior doctor not on a specialist register may cover for an absent consultant to ensure the provision of care. Any doctor who occupies a consultant post, even if he or she is not on the specialist register, would still hold a medical licence and would be on a division of the Medical Council's register. I think that is important. They would therefore be fully qualified to practice medicine. A total of 161 consultants have been identified working in the public health services who are not on the specialist register. Nearly a third of these were appointed prior to the change in the HSE's requirements. The HSE has established a group to examine posts which are filled by doctors who are not on the specialist register and also looking at the issue of recruitment and retention challenges. It's currently undertaking site visits and engaging with senior management at sites and with those not on the specialist division register who occupy consultants' post. Its report and its recommendations are to be finalised and will be provided to my department next month, in March. Once received, officials of my department will then consider the HSE's findings and recommendations in conjunction with legal advices on the matter. One of the possible areas for consideration may be, as suggested by Deputy Donnelly, mandating that patients are informed when their treating consultant is not on the specialist register. However, this would have to be considered having regard to the legal position and the current guidance of the Medical Council in relation to some of these matters. But in direct response to the Deputy's question, once I receive the report next month, I'll be happy to brief him obviously on its contents, and certainly his suggestion in relation to informing patients is an issue that will be considered at that point.
Sir, Minister, what really concerns me is the lack of transparency for patients on this. Last May at committee we were told there was 149 doctors and we were given assurances that the HSE would look into this to bringing this number down. Now, I received information in the last few days saying that the number has gone up from 149 to 161 doctors working in consultant posts who are not on the specialist register. Shockingly, the figures that I have show that for the Midlands Mental Health Service, 44% of doctors working in consultant posts are not in fact on the specialist register. And in South Tip General Hospital, 31% of doctors working in consultant posts are not in fact on the consultant register. Now, Minister, I am glad to hear that a report is coming to you, and I appreciate that some of the recommendations can wait for that report. But do you not agree that regardless of what your report says, patients have a right to know if the doctor that they are seeing, who they believe is a consultant, they've been told that they are seeing a consultant, do you not believe that those patients and their families have a right to know whether that doctor is in fact a consultant or not? Thank you.
Allow the HSE complete this work, and considering this work is imminent in its completion, it's due to be completed next month, I do want to be guided by that, because the HSE is currently pursuing a range of initiatives to improve the recruitment process and to support those who are not on the specialist register pursue registration, because as the Deputy was good enough to acknowledge in his opening contribution, there may be people here who are well entitled to be on the specialist register but simply haven't actually applied to be so, but have the qualifications to do that. For example, those appointed properly prior to 2008 could be dealt with either perhaps by a deeming provision as part of the definition of a consultant. So I do believe we can reduce this number, we can address a number of these cases through that situation as well. I do need to say, though, because I don't want to be lost in the debate, the fact that notwithstanding recruitment and retention challenges, the number of consultants has increased by 125 in the last 12 months to the end of December 2018, and by 540 in the past 5 years. There are 540 more consultants working in the Irish Health Service now than 5 years ago, but I'm happy to revert to the Deputy when I receive the report.
Thank you, Minister. Minister, there are three things that I would like to see happen and that I would like to see you issue instruction on. The first is that it is mandated that if a patient is meeting a doctor who they believe is a consultant, who is in a consultant post, and that doctor is not on the specialist register, that patient is told they're not on the specialist register and why they're not on the specialist register. Secondly, I would like every patient who has seen such a doctor, who believes they have seen a consultant, believes they have been assessed by a consultant or treated by a consultant, who is not in fact a consultant, that they are informed that the person who treated them was not in fact a consultant, contrary to their belief. And thirdly, Minister, I would like you to instruct the HSE to do an analysis of this cohort to see if there is an unusual level of issues, patient safety issues, issues of negligence and so forth, because it may well be the case that there are serious patient safety issues around people being treated by doctors who are not consultants, who they believe are consultants. And I would like you to take that under consideration. Thank you.
What Deputy Donnelly suggests in that regard, and I will reflect on it. I would make the point, though, that the Medical Council obviously is the regulator in relation to our doctors, and it is important for patients, for our citizens to know that there's no suggestion, nor is Deputy Donnelly suggesting, that these doctors who are not on the specialist register are not fully qualified in medicine. So I think that just is an important point, and one that I know has been highlighted by the Medical Council. I will, as I said, make a decision in relation to the issue of mandating the HSE to inform patients based on the report that I will receive from the project being undertaken by the HSE, which is due to conclude next month. And I'll also, at that occasion, take an opportunity to engage with the Medical Council, and perhaps it's something that the Health Committee might wish to do, to engage with the HSE and the Medical Council as well, to see how best we can square this circle.